Hello, everyone. Thank you all for joining us on World Usability Day. I see people are still coming in slowly, so I'm not going to jump into it too quickly, but thank you everyone for joining us today for this really exciting webinar, The Good, the Bad and the Ugly, Usability Lessons from National Health Apps. It's really exciting webinar, so really looking forward to passing over to Danny. But before that, there are a few just housekeeping steps that I'm going to go through. So today's session will last around an hour. We have kind of 40 to 45 minutes for the presentation. And then for the last 15 to 20 minutes, that time is just going to be available for any questions that you might have for Danny. Everyone who signed up today will receive the webinar. It has a full recording next week, but please don't use that as an excuse to drop off early. The Q&A sessions are always good fun. So if you do have a question, feel free at any time during the webinar to drop it in the Q&A window. You can find this by clicking the Q&A button located at the bottom of your screen. And we'll get around to that, as I said, at the end of the webinar. But you can also reach out to us after the webinar on Twitter as well, using the hashtag UXDuck. And just in terms of accessibility for this webinar, so automated captions are available if you need them. If these are not already turned on for you, you can switch them on via the transcript button located at the bottom of the screen. Otherwise, we do know that automated captions aren't always perfect, so we'll make sure that our on-demand version will be provided with manual edited captions as well, just in case you miss anything. I think that's all the housekeeping for me. So I'm going to pass over to Danny for our presentation today.
Hello, everybody. So I know we have people from all over the world that have joined us. So a really impressive list of people on the Zoom call today. So welcome again. So we're here in London, UK. So I know some of you have joined, or many of you have come from different time zones. So thank you so much for coming, whether it's morning time or evening time, wherever you are. So yeah, just a bit about me. So my name is Danny Bluestone. So I've been fascinated by digital and interactive media since pretty much since I was a kid. Eventually, I took a career in human-computer interaction, creative technology, and did a master's degree in design for interactive media. I then specialized in user experience, service design, as well as also working even as a web developer throughout my career. But eventually I decided to set up CyberDuck to really bridge the gap between design, technology, content, to make sure that users get the best possible experience, quite often dealing with very complex projects indeed. Just a bit about me personally, I have two young kids. And enjoy music. I used to be a DJ, as a fun fact. So in terms of where I work today, so I head up CyberDuck. So we're a digital transformation agency, and our main mission is to make the web inclusive and accessible. So we don't just strategize and design, we actually build applications and develop accessible solutions for clients. We have a number of different organizations that we work with across the world. One of the clients is actually the NHS, the National Health System in the UK, where we work with them on various projects. Equally, we work with other government organizations, public sector institutions, and then private sector. We work with insurance companies, financial sector, we work with many banks, and there's some other sectors as well that we're involved in. So I'm going to talk today about electronic health records, usability. It is World Usability Day today, so it's an incredibly important kind of time really to be talking about this topic, particularly with all the things that are happening over the world with regards to public health. But essentially, I'll talk about digitalisation in healthcare. I'll talk about Finland and what's happening over there, and then talk about the fundamentals of national healthcare usability, and then conclude. So where does my passion for electronic health records come from? So besides obviously being the UX service design practitioner by background, I had a incident where my mother went to a routine checkup, and then obviously she wasn't diagnosed correctly. The medical records weren't accurate, and then immediately she was pulled into an emergency operation to have a triple bypass. Now, with better diagnosis, treatment, and notifications, and a much more coordinated health records visible both to her and the medical team, like GP working with her, this could potentially have been prevented. And this is what I'd love to see from electronic health records is much better data to basically help patients all over the world understand what is happening with them, and not only patients, obviously healthcare professionals as well. So there are some countries, particularly smaller ones like Israel and Estonia, that have extremely proactive healthcare models, and preventative care is a big part of what they do, to a point where they can personalize the notifications based on a user's medical backgrounds, and nudge patients for various kind of checkups and prescriptions, which is a very intelligent way of working. But we also need to talk about the usability and efficiency as well. And ultimately, we need to move towards a patient-centered model in this digital world that we live in. So I just wanted to talk a bit more about digitalization in healthcare. There's obviously been tremendous advances in the last 50, even 100 years in medical technology. The first electronic health record model was actually created in 1991 by the Institute of Medicine. But there's still a long way to go, really. There are various standards, international standards like HL7, which aim to make all electronic health records globally interoperable. But there aren't really many signs that that's working to a point where actually end users are seeing the benefit of it. So there's a long way to go, and a lot of my talk is going to be about this. And that there is this recognition that we need to embed systems into healthcare, not just into national healthcare services, but also into all of this next generation technology that we have in our smartphones as well. And there are some examples of where it works really well, but in most instances it still isn't there yet. I think the private sector clearly is doing some great things around user experience, and doesn't have the inherent complexity that the governments have with national health systems. But what is the elephant in the room? It is COVID. So I'm sure many of you have seen the diagram where COVID-19 was like this big ball that basically unleashed digital transformation everywhere. But there's been tremendous uptake of health apps, national health apps. So in some countries, we've seen an increase from 15% before the pandemic to about 95% after the pandemic of the population using national healthcare apps. So it really has accelerated digital transformation. And really, for digitalization to succeed, it has to have stakeholder engagements across the medical spectrum and workflows, and also with regards to user behavior. There's obviously quite a lot of resistance in different across the medical spectrum, that is. So I remember when, and this is even 4 years ago, when we had our baby. many of the practitioners, if not most of them, were still using pen and paper to write notes, medical records. And we had to walk around the hospital with a folder, which meant that other people couldn't read other practitioners' handwriting, and information often got confused. And this is happening still today. And part of the frustration that patients have is they cannot access and manage their data easily on the platforms. So from obviously viewing a test results to, let's say, viewing other information like a visit to the GP. And then the healthcare professional has problems with data entry, also with things like legibility of the data, even terminology, as well as data interoperability with other medical professionals. And these medical professionals could be in the same practice, or they could be in another hospital, and potentially even another country as well, or possibly scientists. So in the meantime, there's been an explosion of digital health apps. Interesting stats, there's 350,000 digital health apps out there from all over the world, really. So it's really interesting. Obviously, they're not all national health service apps. Some of them are other apps like dietary apps and wellness apps, but there is a myriad of apps out there. And as you can see here, the national and kind of medical apps, if you look at the orange color, are only a small part of the pie. So you have obviously weight loss apps, you have relaxation apps, fitness and activity trackers, as well as dietary apps as well. So at CyberDuck, we recently ran a survey at the type of, and I'll tell you more about the survey later, but we surveyed over 50 people on what type of health apps they use, and a large proportion of them use fitness and sport apps. I'll tell you a bit more about the demographics later on in the deck. But apps like Strava, for example, as you can see here, are really good. It records all of the data. It never removes the data. And it also has various behavioral nudges and challenges as well. So it's actually a very, very user-friendly app that is extremely popular. This is a study from the University of Shenzhen in China, and there'll be more on this later, but essentially it breaks down the components of successful health apps. So from obviously things like aesthetics, which again is a fairly obvious one for the designers out there, but also things like customization, having elements of enjoyment, and obviously things like mobility, where people can access their information from wherever they are. Sociability, which is an interesting one, informational support, emotional support, the perception of security, and of course functionality and utility. That's obviously a key one, as well as the quality of information. So what you'll see throughout this presentation is there's been numerous comments from users in particular about the quality of information, be it accurate, the fidelity of information as well. These are all things that users want to see. And there are various barriers to success with regards to national health apps. So the first one is systemic. There's obviously complex operations across hospitals and obviously surgeries, as well as kind of relationships between, let's say, hospitals and pharmacies in terms of how data is transferred. Then there's regulations as well, which can be a barrier in many instances. There's things like costs. So many governments are struggling with funding these apps and actually developing the apps in the first place. Then there's obviously ethics, be it a lack of trust in the technology, the third-party vendors that are sometimes involved in building the apps, and of course data security. And then of course there's user acceptance as well, which is obviously clearly a barrier. So if you have obviously a population that can't use an app for a particular reason, there has to be initiatives to normalize that type of behavior and or support users with other forms of accessible usage. So with regards to Finland, I'm going to talk quite a bit about Finland in this section. It's an interesting country for a number of reasons. It's obviously got, it's a very large country, but it's very highly dispersed. It's got probably one of the world's most decentralized and fragmented healthcare systems. So there's 309 municipalities, and obviously each municipality could be very, very tiny, with as little as 100 people, to almost 1 million people in places like Helsinki. And of course, this is where one of the key challenges is that the standards of care will vary across the different municipalities, simply because you'll obviously have much better facilities in a large city than you would in a tiny village in the north with 100 people. So obviously that then manifests into a digital experience that will probably not be optimal for different populations and could be unequal. It has a universal healthcare system, and then it's a mixed system where it's not free at the point of use. There's out-of-pocket costs for all health visits. And then there's also like a two-tier occupational system where, for example, employers are forced to pay into a private healthcare pot as well to cover the out-of-pocket costs. So it's quite a complex system. But essentially, governments have risen and fallen in Finland, partially due to the digitalisation of health. And what governments have tried to do is overhaul the fragmented structure and the funding of this particular healthcare system. But what they realised in Finland is they need to turn to electronic health to tackle the issues of costs and the ageing population. They needed to work around the fragmented municipal structure, which was a key challenge for them, and then obviously cover the two-tier occupational and private healthcare with a national system together. So it's not an easy, despite the fact that you'd think that it's a small country or small population, the challenges were immense. But this is just a bit of a backstory to how it happened. So starting at the bottom left, they created the national strategy in 1995 around ehealth. It was developed further around 2007 to ensure a full path to digitalisation. So obviously the fact that they had that vision is very good. And this is quite impressive that by the mid-2000s, 96% of patient records were digital, although not fully interoperable. And then they had digital prescriptions in 2010. And then they introduced the ehealth architecture, Kanta, in 2010 as well, moving to various kind of innovations after that. And essentially this slide sort of explains the more from a, if you work in government or private sector, you'd probably be interested in this. It shows basically what composes the Kanta system. It's essentially pharmaceutical database, prescription services, patient data repository, medical certificate reporting, and then interestingly it has My Kanta integration. This is more for private apps, but there's also a portal there for patients. Then there's an organ donation system, an old data patient archive, as well as social welfare data, which hasn't yet been concluded from what I know. So what does this look like in practice? Obviously, like other countries, the usage of Kanta surged following the pandemic to 92%. The most popular functions were browsing prescription information, so that's like 97%, health records 96%. But essentially, what you can do as a user on Kanta is access full electronic health records, see who's accessed the records, and set up permissions, which is important if you want to manage dependence, view, order, and renew prescriptions, and register organ donation wishes. And what Kanta does is it also provides authorized apps to leverage the data that it holds. So, for example, there's 2 diabetes management apps. There's a further application that extends the functionality of Kanta further. So it includes things like appointment booking, symptoms checkers, relationship counseling, and sleep coaching as well. As well as a kind of an app for elderly to help them keep fit as well, called Digital Well. So it's quite interesting. But the reality is, and just sort of looking at the barriers that exist for healthcare professionals out there, and despite the fact that Kanta is a sort of almost spine for all the health data in Finland, a study found the following: 40% of healthcare professionals agreed that terminology is clear and understandable. So that isn't obviously a majority, it's 40%, not 60%. So it's obviously clearly there's room for improvement. 33% said that entering and documenting patient data is easy, so that's only 33%. And less than 50% of healthcare professionals agreed that the fields and functions and layout is logical. So obviously there's a lot more work that needs to be done on those things. Obviously, effective communication is critical, not only between healthcare professional internally to another healthcare professional, but also with social worker services, and obviously to the patient directly, where there were clearly problems between the user getting messages from the healthcare professional and vice versa. Only 16% of healthcare professionals felt their system performed very well with patient communication, and 64% of healthcare professionals, and this is quite a large number, felt that the system performed very poorly or very poorly when collaborating with other healthcare providers or organizations that are in the caregiving ecosystem. So 7% of the healthcare professionals agreed that the electronic health record system is actually improving the quality of care. So that is obviously a relatively very low number indeed. In other studies, we found that again, the general acceptability score was 46%. So again, not the highest. So again, more work to be done. And you can see on the right-hand side the type of functions and features that users really want. Things like prescription renewal, viewing prescriptions, viewing test results, viewing notes from the last visit. So in many countries, the UK included, you can't actually view notes from your visits to healthcare professionals. So obviously it is quite outstanding. It's 2022. So So 8% of people in Finland do not use My Kanta. And what research found is the main barriers are the following. Literacy, so lack of digital or language skills. So obviously if you're not Finnish, and from what I've heard, it's not an easy language to learn, you're going to have issues. There's another problem around e-identification. So that's like the national identity cards that you may not be able to afford, or you just may not have access to, or you might be waiting for those sorts of documents to come through. Then there's a further problem around safety and fear or just trust in digital generally. You'd be surprised at how many people still need to be reassured. And then some patients just may not be aware of the value that the system provides. And then other users may not just have access to the right devices or technology. At CyberDuck, we have something called the 5 pillars of inclusion that we pretty much can use to assess any particular service like this to determine how inclusive it actually is. So despite being sort of one of the better examples out there in the world, it still has usability issues, both on the healthcare provider side as well on the patient side as well. What's interesting is that patients themselves are more satisfied than healthcare professionals are with the Kanta ecosystem, which is quite interesting in its own rights. So I think to get the adoption of healthcare professionals is absolutely vital for success for the patient experience. So let's look at some of the fundamentals of how these national healthcare apps can be more usable. So as I mentioned at CyberDuck, we ran a study with 52 users. It was both qualitative and quantitative. In a sense, it was a relatively small sample of users. Most were from the UK. Most were between the ages of 30 to 49, so not truly representative. And it's interesting. Less than 4% said that they didn't use health apps at all. But most of the users who didn't from the study that we ran, who didn't use the national health app, say that they didn't see the value of it, they just didn't have the needs, thought it was useless, and no immediate requirement. If we look at other apps from around the world, so obviously we looked at a number of different apps. I will read this one out because I just think it's quite amusing. So this particular, and this is for one of the Israeli apps out there, because what they did in Israel is they redesigned the app, and probably by the looks of it, didn't test it properly. So the ratings used to be very, very high, and when the new app was released, it got sort of some really terrible reviews. But this particular app said, I can't say how many times this app is down. It's an obstacle course designed for masochists. So yeah, it's truly, some of the reviews are sort of yeah, just sort of pretty entertaining in their own rights. So from our research, what we found, there are 6 key components for national health apps. So the first one, and of course the most important one, is functionality. Like, the app has to offer the utility, the basic features that a patient or a user would need to use the app. Obviously, the other imperative component of an app is accessibility. It has to be highly usable in a variety of different situations on a number of different types of devices. Thirdly, another driver is accuracy. Users want to see accurate apps that present the right type of information, and there's many comments about from users about not being able to edit, for example, the data on the app, or challenge the data. Another facet is security. So clearly, medical data is considered sensitive information under GDPR, so it has to be secure. And then personalization, people do not want to see generic information. And then mobility, just being able to move around, whether it's nationally or around the world, and being able to use the app, but also being able to leverage the different healthcare providers, because you don't just want to have an app for the sake of having an app. You want to actually be able to use the app in a medical professional as well. So some of the functional requirements and again, many of these users were in the UK, quite a few were outside of the UK as well. But this is what they said about their particular national app. I can't book appointments, I don't get any preventative care, and I can't see my medical history. I tried to obtain health records through the app, but wasn't able to do so. I won't bother using it now. And the app is missing essential features, such as comparing test results and other reports. This example here is from the US, so it has particularly high ratings compared to the other countries. And I think you can see here, not only from the reviews, but also from the screenshots, why this particular app is very popular. It has a lot of really good data that other national apps that we've looked at do not have, like blood pressure, weight, as well as the medications, and even instructions on, if you compare this to, let's say, the UK National Health Service app, you don't get any instructions around your medicine at all. So I think obviously the point is this is a for-profit type app, so that it's not like funded by government like the European ones are. So that's potentially, I'm not saying that this is the only reason, but possibly one of the reasons why this particular app is better. Maybe they have more funding. So central to great apps is mobility and interoperability. So obviously users want to be able to use the app on the go. They want to be able to see, so in some countries, for example, we heard that if you live in a particular area and see a doctor, and then go to another part of the country, essentially the healthcare providers are using different systems and it's not interoperable. And this is happening in Western Europe, by the way. So it is a key problem. One of the things, based on another study that we did, is certain people tend to move from country to country. So that's when it becomes an even greater problem. If there's no international standards for medical records, how are you going to take all your data and plug it into a new app? That simply isn't going to work if the systems behind the scenes do not give that facilitation. So one of the facets, as mentioned, is simplicity. How easy is the app to use? So there are certain, so Livy, for example, is another UK healthcare app, which actually enables you to change the language. Obviously, it's the UK is a very diverse country with many different populations. And what you can actually do on this app is change the language to suit yourself. Another key driver is simplicity. What we have seen is many users saying that the account setup is a nightmare, and they weren't able to get this particular information. And another user said that every time they log into the app, it asks them to provide the same information again. So that was very frustrating for them. So accessibility and simplicity are obviously key. What we've seen in a number of different countries is confusion from users around, and the UK is a great one, where there's multiple NHS apps. For example, there's an NHS app, and then there's an NHS COVID app. And a lot of users were getting confused on why you need to have two apps. So that's something that, particularly with older demographics, so people who, let's say, are in their 80s or 90s, it would potentially be extremely confusing It also will be confusing for certain neurodiverse users as well, and frustrating for them on having multiple apps. So this is a theme that we found in our study as well. Another big one is personalisation. So 72% of people in our study said that they would want their data to be personalised. Essentially, this particular quote here, again, I just love it. It says, I want personalized advice about my health, not just answers from a crib sheet. So I think maybe in the UK, we take it for granted, like the NHS has a fantastic repository of really well-conceived content. Other countries don't even have that. But I think what users want is the extra step. They don't just want to see generic information, they want personalized information. Another user spoke about predictive health using genetics, so being able to plug in things from various apps like 23andMe and My Ancestry. Based on your genome, you can get further personalized recommendations. They want to see that converge with the health app as well. Obviously, in order to achieve personalization, it has to be balanced with privacy, and this is where the scale comes in. And because it's sensitive information and medical data, it's not the same as like Netflix's recommendation engine, right? Like there has to be a higher degree of protection. Another theme is definitely accuracy. In this particular quote, the user said, I'd like to have access to trusted content and searchable health conditions with recommendations of actions. Googling is a minefield. Yeah, I mean, just getting that accurate information is a key one. Another point on accuracy is again the actual based on the qualitative feedback that we saw. There was a growing frustration among users that they saw inaccurate information within the app itself, but they weren't able to challenge it, change or edit that information. And this is supported by academic studies as well. There's a lot of variation in the data accuracy. So just to summarize, there's quite a big mismatch between what users want and what is actually delivered. It's not necessarily the fault of the national healthcare provider. Obviously, we're talking about governments, we're talking about international standards. It's not an easy thing to remedy, and it does take, as we saw from Finland, decades. They started the projects in the 90s. Just to show you a quick infographic to highlight some of the complexities, and this is from the American electronic health record markets, and this is just showing you kind of the vendors themselves that are involved in this whole kind of service blueprint of being able to actually offer electronic health records in the first place. Across the patient experience, there are multiple vendors. Then there's telehealth, then there's clinical workflows. So these are all vendors that provide systems and products that feed into electronic health records, surgical devices, revenue cycle. Obviously in the US, it's chargeable, population health, as well as patient flow, interoperability type vendors that are also involved, and then innovation as well. So just to summarize, many of you on this webinar do not have the luxury of starting your national health app with a blank sheet of paper. But there are a variety of methodologies that you can use to help both the user and medical professionals to ultimately improve patient care and efficiency. So obviously, clearly, government support, so national health apps need to be driven by specialized digital units with the right training and the right vendor support. Obviously, considering society at large, there's various international standards as well that can be leveraged and utilized, but also improved themselves. I've seen quite a few really good initiatives on GitHub around standardizing electronic health records. And what is really important is user research. So it's obviously great service design and UX practitioners will be constantly doing research across different persona types. But this is also true within the healthcare provider spectrum. There needs to be a lot of user research or stakeholder research with them as well. The other thing that has to be considered is the role of the private sector. So from hardware to software, all the way to kind of staff outsourcing, private medical, it's obviously a big consideration in everything that you do is how the private sector feeds into the national health apps. And then there's the technology stack. So clearly taking the route of a modern API-driven type system with privacy by design built in. This should be conceived and thought about from the outset. And then as technology advances, things like genomics, AI, and telemedicine unleash new innovation opportunities. So that's something that needs to be factored in to what you do. Service design is a great profession or type of service. It can help to map out the end-to-end journey and all the blueprints. So that's something that we do here and strongly recommend as well to deliver these type of projects. And then program management. So it's obviously ultimately whatever strategic thinking and design you have, it needs to be developed and implemented through agile learning technology. So this is the end. Be more than happy to answer any questions that you may have. I'm just going to start sharing my screen now.
Cool. Thank you so much for that, Danny. Yeah, we do have a couple of questions that have come through, some really interesting ones. We want to start with, what are the benefits of an agile methodology for healthcare apps for so many stakeholders? Can it still be agile?
Yeah, so I think again, there's different methodologies for national health projects. One of the more common one is scaled agile. So again, and combined, so that's a combination of lean and agile methodologies that allows a more strategic overview of the program, and then delivery of kind of projects and using Scrum and Kanban. So there's different methodologies that are in place. I think a lot of it depends on what methodologies are being leveraged at the moment, how successful are they before you decide to, let's say, move on to another methodology. It also depends on the experience of the people with that particular methodology, but generally lean and agile as a high level umbrella is the way to go with these sorts of programs.
That's great. Got another one here. Is it worth creating a MVP for a healthcare app, or do you have to design a fully functional feature-led app which covers the 6 key components right from the start? What do you think the threshold for acceptance should be?
So I think the MVP would need to tackle the 6 components around functionality. You don't necessarily have to have all the functionality, but you need to have some. I think that the NHS is app here in the UK. I would argue that it was almost too basic when it launched, but it was mainly around the time when COVID started, and it basically had really basic functionality. And obviously it's very hard to judge on the decision-making process they made, but the MVP is essentially the what functionality you launch with, but the 6 components have to be there. Things like accessibility, you know, these are all really key facets that need to be included in any MVP.
I've got to do a couple more questions here. Before designing your healthcare app, what key elements do you think already need to be in place? And maybe going back to that sort of service design question.
Yeah, I think it does. So what I would recommend there is using the service design, using service design type thinking and creating an as is journey map, and then a to be journey map, which is essentially what you have now versus how things could be. And that will give you a good illustrative model of where you need to go. So that once you've got those journeys created, you'll be able to figure out what the future looks like.
Yes, brilliant. Maybe looking towards the future, where do you think we see healthcare apps, and with particularly national healthcare apps, going in the next 5 years?
Well, I'd say they need to become. It depends obviously on which country. Some countries are ahead of others, of course, but ultimately they need to be educational. I think they need to be what we've seen in certain countries, particularly the smaller ones, where you have smaller populations and higher degree of innovation, is personalisation of medical information. So it's not just generic information that users are getting. Clearly, it has to be user friendly. And also, I think starting to see things like push notification, where it nudges people in a persuasive way to get diagnosed. Like in the UK, we still haven't seen this type of functionality from the National Health Service Act. But ultimately, you know, I think a lot of providers need to ask them, you know, why do our apps even exist? Is it just for people to order prescriptions and book appointments with their GP, or is it to actually help them lead healthier lives? So I think there's a lot of philosophical questions there, and I think the sky is really the limit in terms of what can be achieved, particularly if you start to look at what companies like Apple are doing with almost medical grade technology within our pockets and on our wrists. If that is integrated into, let's say, with GP and hospital data, that could be very powerful stuff.
Yeah, very much so. Another kind of, I guess, point of a question actually we've had from one of our own members of staff. Do patients/users also need to be educated as to why national healthcare apps may have less functionality? And I guess this gets back into that question of potentially national healthcare providers like the NHS having stricter rules versus insurance-based companies, or something like Strava.
Yeah, I think it's a really intelligent question, honestly. I think that the truth is this is where I think communication, so obviously if you just launch an app with very little messaging and marketing around the app, it doesn't really give people context, and then it can potentially disappoint those audiences. Once they start using the app, they're like, what the freaking hell is this all about? You can't even do this and you can't do that. So I think it's a really good question, and I think the answer is that patients definitely need to be educated, and this is where, because we're talking about governments and national scale, they can definitely do a better job educating, be it in surgeries themselves, or on the radio, or other digital channels like on the web.
Yeah, that's great. I think we can look towards kind of wrapping it up there. I guess, is there anything you'd like to leave our attendees with, Danny?
Yeah, I just think that one final sort of thought is trying to understand from users what they want and why. And when I'm talking about users, it's not just the end users, e.g. the patients, it's the healthcare professionals. Like, how do they work? If you do have the privilege of working with healthcare professionals, try and meet them face to face and really ask them questions around their relationships, or the relationship of data between the different healthcare professionals, to understand how data is being transferred, how is data being recorded, and what the outputs of the data is, because I think that's where there is a serious challenge. And I think until those challenges between how healthcare professionals work together, both internally and externally with other vendors, be it other hospitals or private sector, insurance, pharmacies, I don't think that the optimal user experience will ever exist. So there needs to be a big piece of work around that.
Brilliant. Well, just to say thank you, Danny, for your talk today, and a big thank you to everyone who has joined us. As I said at the start, we will send you the webinar next week if you've had to drop off. Otherwise, please come to one of our future webinars or check us out on social media. We're on Twitter, we're on LinkedIn. You can also check us out on our website as well. We've got lots of fantastic content there. And again, big thank you to Danny, and have a great evening or morning, depending where you are in the world. Goodbye, everyone.
Thank you.